All right, so good afternoon, everyone. Thank you so much for joining us today to learn more about the Community Health Worker apprenticeship that's going to be launching here in February of 2026 here with Governor State University. So we're here to tell you a little bit about what is a community health worker? I'm sure you guys all want to know. And so just to encapsulate that pretty quickly, a community health worker is someone that is a trusted frontline public health professional who is working directly with the community and helping people access care and improve overall well-being. They are a vital link to the community and social systems, as well as healthcare. So a community health worker really wears quite a lot of hats and is very much a social person. So someone that's gonna not be afraid to do a little bit of presenting and things like that. And so with that being said, I want to take this moment to introduce Dr. Tanya Robertson, who will be a faculty member for the program and doing our training facilitation for the community health worker apprenticeship. So if you would like to please take a moment just to chime in, tell us a little bit more about who and what is a community health worker, we'd love to learn.
Yes, thank you so much, Michelle, and welcome everyone. And thank you for coming to get trained for this much needed position because a community health worker is really a very intricate role within the healthcare team. They are a mentor, a partner who understands the doctor's information, the medical information, and the diagnosis, and then they can help community members before they become patients and while they're patients to actually deal with those issues. You all will be available to help individuals, families, to refer them to clinics. If they have food insecurities, and maybe you know about a food pantry or grocery store tour going on in your community, you can share that, or in that community, share it with your clients. If someone is in need of housing or mental health or grief needs, you'll also be the liaison to have that information to share with them. And you'll just be the person that to support people dealing with chronic diseases such as diabetes, strokes, stress, trauma, or even caregiving. So you all will play an intricate role. You're probably saying now, well, where will I get that information? But you'll learn it in this program.
Yeah, absolutely. So also some of the things that you might do is, work directly with families. You might work directly with social service agencies. You might stand in front of a classroom and, conduct a session on, stroke awareness or diabetes prevention, things like that, right? We do have several agencies that have agreed to work with us to onboard um, a community health worker apprentice, and some of their roles are going to be a little bit different, but somewhat the same. So we could talk more about that as we go along. But you are an advocate, you are an educator, you are a guide, and we want you to be that person that's going to make a real impact to improve health outcomes in your neighborhood, help families access vital resources, and really start a rewarding, high demand career. I want you guys to think of this as just the beginning. There are going to be so many additional opportunities that can possibly grow from this as you are making a real impact right now, day one.
Mhm. And I wanted to add that I'm a huge advocate for community health workers. I've worked with community health in both traditional settings, hospitals, federally qualified health centers, community-based organizations like Michelle just mentioned. And there's a lot of different areas that you can work from it in. And the community members usually trust you all more than they would their doctor or nurses. So you are there to help um, regulate their trust. Um, they can come, you're usually from community health workers, are normally from the community that the individuals that they're working with are from, and they help prevent problems before they actually start. So you all are the interveners.
Absolutely. And so and we can answer any questions that you guys might have about what the role is and the function of a community health worker. But we want to talk a little bit in this time about the earn and learn model of registered apprenticeship. And so registered apprenticeship is working and going to school at the same time. So for any of you that are here today, if you've ever had a job and taken classes, that's the model of a registered apprenticeship. With the grant that we received to support the community health worker apprenticeship, it covers your tuition completely. All you have to do is qualify. And the qualifications include a number of different things that we'll talk about here shortly. That is a $3,300 value in tuition dollars. That allows you to focus on learning without the burden of paying tuition. In addition, you will have an opportunity to match up with several different employers and earn while you learn. Those employers will provide a wage to you from minimum wage up. We're looking at right around a $20-ish wage. You will receive wages for every on-the-job training hour, gaining real-world experience and building on your career from day one. So this is a 40-hour-a-week work week. And in addition to the 40 hours a week work, you will meet with Dr. Tanya Robertson and her colleague, Dr. Joseph Day, to learn the curriculum of community health worker. So earning and learning all at the same time. Is there any questions about that? And there'll be time too at the end if you guys have questions, but something to think about.
Michelle, just reiterate the length of the course, because they're not going to be working and learning forever. They're going to be learning for a year and then continue working.
That's correct. So the class itself is 1 year long. And I'll show you guys, we will have a slide here about the schedule in just a second, but here we go. So the class will begin on February 23rd with basically a bridge program. This is a pre-apprenticeship program. This is 10 hours a week of foundation course, and you must succeed in order to be eligible to move forward. So you'll start February 23rd. The matching with the host apprenticeship site will begin March 9th and conclude by March 27th. Your class, the actual class that the grant covers tuition for, will start March 23rd. You'll meet every Monday and Wednesday from 2 to 3:30 p.m. Via Zoom, and you will do this for 1 year while you're working. So for 52 weeks, you're going to meet from 2 to 3:30 every Monday and Wednesday to learn about what does a community health worker do, what are the resources, tools, vocabulary, all of the information that you need to be a productive community health worker. You will learn in this 52-week class 1 year. You will actually begin your job as a community health worker on March 30th. So we want to kind of ease you into it so you can make sure that you've got what you need set up, childcare, whatever it is that you need set up so that you can successfully get to work, be at work, and perform at work. The intention is after you finish your class, the CHW portion of the curriculum, that you stay on with the employer that you had been working with and that you begin to grow. And as you unlock benchmarks as a part of this community health worker experience, you unlock wages, right? You unlock the next level of salary. This is a major, major commitment. And in order to be a part of this, attendance is mandatory for all program components. And that means you have got to attend 100% of your classes, and you have got to be at work, whichever site that is, 100% of the time. You know, so something to consider. Full-time, 1-year training opportunity. We are, and Tanya did talk a little bit about this. We have several different employers that are available, and these kinds of opportunities are opportunities in hospitals, local clinics, healthcare and social services organizations, community centers, you know, mental health clinics, different organizations like this, community leading centers.
Right. And they can be like non-traditional. I know it's community health worker, and so you can work with a stroke prevention and education program, educating community members who have maybe suffered from a stroke, or stroke survivors, or a caregiver of a stroke survivor, with violence prevention programs, and referring or helping community members who are who have experienced trauma or grief from a loved one that they lost, and even educating community members on the importance of clinical trials, participating in clinical trials.
Yeah, yes. All right, so let's keep on going. I think we hit this slide, yep. So I'll let you guys sit here for just a second so you have an idea of the dates. And we can go over that again. Let's talk a little bit more about the curriculum and what you're actually going to learn. So the 52 weeks of classroom time, that Monday and Wednesday from 2 to 3:30, totals 144 hours of specialized virtual instruction. And so you're going to be provided that health education, you're going to be provided some coaching to help keep you supported and to help you keep implementing new things that you're learning as you move through the curriculum. You're going to connect with individuals to healthcare, social services, community resources, some of those places that Dr. Robertson was just talking about. You're going to, again, you're the advocate, you're the voice for your community and for your community's needs. And, you know, at the end of the day, we're trying to reduce barriers to care. We're trying to help support individuals in managing, yes, chronic conditions, but also a lot of different kinds of, you know, conditions or situations, right? Conducting outreach, there may be some home visits, there might be follow-up care, there might be coordination of, you know, different events and activities. It's health equity, it's addressing, you know, the social determinants of health. So you have all of these different kinds of opportunities of learning in the curriculum. So that's 144 hours of things that you're going to dive deeper into. Tanya, do you want to say anything else about this?
I just would like for them to just take a look at these specialized instructions that they'll be receiving. And I know you probably haven't had any experience in being a community health worker, and that's why you're here today. But from looking at these, how do you feel about this? Do you feel that this is important, or do you think it's anything else you may need?
You guys are welcome to unmute yourself.
I have a question,
Yes.
Dr. Tanya. So thank you all for this information. I'm not here as a interested party with becoming a community health worker, but I do have a community-based organization who is willing to participate and assisting individuals to take on this apprenticeship program. So my question would be, how does this look for members that's returning into the population from incarceration? How does this look for them becoming community health workers, or is this just targeted for people who may be just low to moderate income?
Tanya, can you speak to that a little bit? Would people with returning citizens, would they qualify to sit for that test with the state of Illinois?
Yes, they would, and it'll be just like any other job, depending on what the crime was, and that'll determine. It'll be highly individualized on each person. But we'll see where we place them, or we can specifically tailor them to an organization that may be working with reentry that needed community health workers, or with some other programs. But we'll have to just deal with them highly individualized. But all of the employees will have to take a background.
Okay.
Mhm.
And then my other question would be, um, is this something that we can take back to our people and kind of give an explanation? Will we receive this information via email? Or is it, can one of, or someone, I know we spoke about doing a site visit, so, we can set up a meeting to do that as well.
We can share the slides, correct, Michelle? And if you
Absolutely.
need anyone, if you wanted me to come out to be there to present
Mhm.
again, I will as well.
Yes,
Okay,
and I
and then,
can as well, Tammy, no
Mhm.
problem.
And Tammy,
okay,
if you
great,
have,
thank you.
and Tammy, if you have companies that are interested in hiring an apprentice, we have employer-focused info sessions coming up as well.
Yes.
Absolutely. I'll make sure that I pass the word. Is there an intake process to qualify for this program?
Yes. Yes, we're
Okay,
going to talk about it here now.
okay,
So this is kind of the eligibility, and this is, of course, highly individualized with returning citizens and things like that, of course. But really to qualify, it's simple, have a desire and a passion to serve others and be reliable because you've got to be there. That's number one. Um, you've got to be communication savvy. You really have got to be a people person, not afraid to stand up in front of an audience, be at a table, being in the community, making phone calls, talking, right? You've got to be a people person. It's ideal if you have any previous experience in healthcare or social services and you want to skill up for higher wages because, where you start with the program is where you start, but there is growth trajectory there. Um, and we put this in the slide here, Tammy, especially for you, if anybody that you have on staff maybe even would be interested in, then you would be interested in upskilling them to do this kind of work, we would be happy to work with those individuals as well. So ask your employer. And for anybody else that's here, if you're kind of working in the healthcare setting and you'd like to stay as part of your agency that you're working with, ask your employer, hey, can we do this? Can you help me get trained in this way? Got to have a little bit of computer skills, and how do I create a document in Microsoft Office, a PowerPoint, a speech, whatever the case may be, right? 18 plus, a high school diploma or GED. Looking for Illinois residents with valid U.S. work authorization, so social security card, passport, birth certificate, stuff like that. Must also pass a drug test. And that is primarily dictated by our employer partners. And then background check. So that's very, very important. The enrollment process right here. So that QR code that you see in the corner, and we will send out this PowerPoint, and I will also drop the application in the chat. is a link to begin the formal application. And so the formal application does require some uploading of documentation to qualify you. And so you'll see all of those documents and what we need in that link that I've just dropped in the chat for you guys. So take a look at that, and also feel free to look at that QR code. There is a little bit of a test. We need you to complete a basic skills CASAS reading comprehension test. We want to make sure that you're okay there, right? And then for those that complete their documents and complete the application and are selected to be moved forward based on qualifiers, a case manager, likely myself, will follow up to complete the intake process with you, and we'll also discuss program requirements and barriers to participation. We would like you to complete an online career exploration, and we need to confirm all documentation has been submitted. We are going to begin all candidates on February 23rd with our pre-apprenticeship. And that is a 20-hour program that you will engage in just to sort of pre-gain you so that you're ready to, engage in different functions on the job. And then on March 18th, we will have an orientation session via Zoom just to go over logistics and firm things up with each one of our apprentices. So I'll give you guys just a minute to take a look at this slide a little bit more closely and grab that QR code. And are there any questions about this part of it, this application process at this time? All right.
My question would be, where would the CASAS reading comprehension test be administered?
It'll be administered here at Governor State University. We do have a testing facility on our site in our building. And so that will be administered here, and there'll be different times that you'll be able to, or that the individuals will be able to take it. So right here on campus. Are you close by? Sort of?
Yes, we are located in Harvey, so I believe we're close enough.
Perfect. Good,
But
yeah.
just for the people that's on the line, if for any reason you all are lacking any of those documentations that's required to attend the apprenticeship program, Ascending Knowledge can assist you with obtaining those documentations, such as your high school diploma, and etc. So.
Oh, that's great.
I can actually put a link to our registration in the chat as well.
Yeah, thank you.
Cool.
And your email. And everyone on the call, please don't forget to add your email address so we can stay in touch with you.
Yes, please. And then here's our email address, healthcareers@govst.edu. And then here is our phone number. You guys, we really want to see you ask any questions that you might have about this. We're happy to help. We will be in touch. Anybody that has dropped in their contact information, I will make sure to reach out with you with a copy of this PowerPoint and also the recording, so that way you guys can review it and kind of screen and things like that. But there's our contact information. And I'm going to stop recording now. And I invite you guys to please ask any questions that you might have. I'll stop the recording so you don't have to feel shy.